Good morning, everyone. We are from Gede and today we are going to share to you about role of intravenous pyelography in urinary system disorder. My name is Aisyah Lathifah with three last digit pseudo number is 076. 1.1 Introduction. The urinary system is the system where the blood filtration process occurs, allowing the blood to be free from unnecessary substance and absorbing the necessary substance for the body. The supporting examination that can be used to diagnose these cases include complete urine examination, cystoscopy, uteroscopy, and intravenous pyelography using contrast. Intravenous pyelography is the gold standard for diagnosing oral lithiasis. By injecting contrast into the vein, physicians can visualize the blockage, which is interpreted by the contrast moving too slowly or not at all. This article will discuss the role of intravenous pyelography in urinary systems. 1.2 Problem formulation. 1.121 What is intravenous pyelography? What is the standard procedure of intravenous pyelography? What is indication of using intravenous pyelography? What can be interpreted from the result of intravenous pyelography? And the objective is to know the basic intravenous pyelography and its development, to understand the standard procedure of intravenous pyelography, to know the indication of using intravenous pyelogram, to understand the result and interpretation of intravenous pyelogram. And for the benefit, for increasing student knowledge about intravenous program, this literature review aims to provide a better understanding of the history, procedure, indication, and result interpretation contraindication, including patient safety and education of intravenous program. It is hoped that this research can also become a reference for related research in the future.
Thank you for the opportunity. My name is Gede Saputra with last three-digit number of name 018, and I would like to discuss with you guys about the basics of intravenous pyelography. Intravenous pyelography, or IVP, is a diagnostic test that involves the administration of intravenous contrast and X-ray imaging of the urinary tract. The iodinated contrast flows through the renal vasculature and filtered into the collecting system, highlighting the anatomic structures on the X-ray image. It is often useful for the evaluation of hematuria, renal stones disease, and as a follow-up after the intervention. The urographic imaging sequence is designed to depict specific parts of the urinary tract optimally. Portions of the urinary tract system appear opaque when filled with contrast material. Accurate conclusions from the IVP are visible only when the technique limitations and basic rule of interpretations are known.
And now we'll explain about the development and history of IVP. Intravenous pyelography or IVP emerged as a significant diagnostic tool in the early 20th century. And prior to IVP, retrograde urethral catheterization was attempted but yielded inconsistent results. And in 1923, Osborne and colleagues introduced IVP, which involved injecting iodide contrast material intravenously and then capturing X-ray images to visualize the urinary system. This method was simpler, safer, and more practical. IVP played a crucial role in diagnosing various urinary tract conditions, but over time, the other radiographic modalities have gradually replaced IVP. Non-contrast computed tomography or NCCT has become the gold standard for diagnosing many urinary system disorders. That's all from me, and the next part will be continued by my colleagues. Thank you.
Hello, doctors and friends. My name is Christine Natalia with the three last digits to the number 109, and now I'm going to present the procedure of IVP. There are some materials required for the IVP procedure: contrast material, radiologic table, X-ray tubes, monitor, fluoroscope, and detector. And so the step-by-step procedure of IVP is to evaluate initial images first from the kidney, ureter, and the bladder radiograph, and then administer the contrast into the body, and to evaluate the nephographic images or oblique image after 1 to 3 minutes. And then the KUB radiograph following 5 minutes after contrast administration, and then to apply abdominal compression immediately after getting a KUB radiograph. And then we do the compression, and 5 minutes after the compression, we have to obtain the pyelographic images during early bladder filling. And immediately after the release of compression, obtain KUB radiographic and fluoroscopic spot images of ureters. And the last one is to obtain the radiographic image of the bladder.
Hello, my name is Carla, and my last region number is 016, and I'll explain about the indications of intravenous pyelogram or IVP. So IVP remains relevant in specific clinical scenarios despite newer imaging technologies like CT becoming more prevalent. These techniques involve pre-contrast imaging, followed by X-ray imaging to visualize renal morphology, to identify hydronephrosis, and to assess urethral drainage. It is particularly useful in cases of renal trauma between surgeries and in locating ureteric stones, especially in shockwave lithotripsy procedures. And also, IVP is indicated in cases of hematuria, pelvic or low back discomfort, and suspected urinary tract anomalies. It serves as a valuable diagnostic tools for conditions such as enlarged prostate, urinary tract stones, congenital abnormalities, and urinary tract neoplasms. So that's all from me. Thank you.
My name is Adrianus with my last three digits of my student number 104. I'm going to explain about the potential diagnosis that can be found using IVP. So there are three things that can be assessed: kidney, ureter, and urinary bladder assessment. I'm going to explain about the kidney assessment. So there are 12 things that can be assessed in kidney assessment. The first one is size. As for the reference, the normal length is 10 until 11.5, and the normal width is 4 until 5.7 centimeter. Next is the position. The anatomical height of kidney is from the equivalent of T12 until L3. And then there's the vertical axis, which is parallel to the upper third of the psoas major. And then we can assess the renal contour and symmetry. Normally the contour is smooth, and then we can assess the renal parenchyma and thickening. As for the thickness, it's 2 until 3.5 centimeter. And then we can see if there's a scarring in the kidney. It can refer to CKD if it's found. And then there are cysts that can be found, which refers to PCOS and multicystic dysplastic kidney. We can also found double contour of parenchyma in IVP. It's found in developing tumors. And then there are rounding of pharyngeal margins, which refers to early obstruction of urinary tract. And then is loss of papillary impression. It can be found in chronic obstruction of the urinary tract. Next, there is abnormal calicial configuration. It can be found in post-inflammatory condition. And in IVP, phantom calyx can be found in neoplasm. And the last one is aberrant papillae, which can be found in renal cell carcinoma.
Hello, my name is Kevin Andrian Candra with my jet number 095. Today we'll present about ureter assessment. They are divided by 6. The first is second symmetry of the ureter. Normal, same size, same shapes, and same position. If there are difference, this can indicate various abnormalities. Number 2, ureteral diverticulum or diverticula. The visible abnormality is the presence of a small port protruding from the ureter wall. Diverticulum is an abnormality caused by infection, kidney stone, or weakness of the ureteral wall. Number 3, ureteral obstruction. Ureteral obstruction is a blockage of urine flow in the ureter that can be caused by kidney stone, tumors, stricture, or congenital abnormalities. Number 4, medial and lateral deviation of the ureter. The condition where the ureter moves from its normal position can be caused by a mass tumor or anatomical abnormality. Number 5, obstructive and non-obstructive ureteral dilatation. Obstructive ureteral dilatation is a condition where the ureter widens due to obstruction of urine flow. Then non-obstructive ureteral dilatation, namely widening of the ureter without any obstacles. And number 6 or last, the ureteral caliber asymmetry. This condition is characterized by difference in the diameter of the right and left ureter. This can be caused by obstruction, stenosis tumor, or congenital abnormalities. That's all from me. Thank you.
My name is Nandhita Naaz with last digit of my student number 189. And now I'll explain about the potential diagnosis for urinary bladder assessment. While the primary focus of an IVP is typically on the kidneys and ureters, abnormalities in the urinary bladder can also be detected. During the procedure, bladder conditions such as wall thickening, diverticula, neoplasm, or stones may be diagnosed or assessed. For bladder wall thickening, abnormal thickening of the bladder wall, which may be indicative of inflammation, infection, or other conditions, can sometimes be visualized on the IVP images. For bladder diverticula, or sac-like structures that can develop in the bladder wall may be detected during an IVP if they fill with contrast material. For bladder neoplasms of the bladder might be viewed as filling defects, and early bladder filling and the post-void phase are the most sensitive times to identify filling defects. And lastly, for bladder stones, when bladder stones are present, they may appear as radio-opaque structures within the bladder on the X-ray images obtained during the IVP, and radio-opaque substances like calcium-based stones absorb X-ray, making them visible on the images. However, small stones or stones composed of materials that are not easily detected by X-rays may not be clearly visible.
Okay, thank you for the opportunity. My name is Wilbert Purnamasidi with last digit of my student number is 135, and now I will explain about 2.6 result and interpretations. So the result of IVP is like the image on the left side of this slide. An IVP result provides visual representation of urinary structures, post-administration and filtration of contrast by the kidney. The interpretation involves analysis of this image to identify abnormalities such as kidney stone, congenital anomalies or abnormalities, obstruction, or neoplasm. And the information regarding the function and anatomy of the kidney, ureter, and bladders is gleaned through IVP, including size, shape, and structures of these organs. And that's all from me. I give it to my friend. Thank you.
Hello, my name is Margaretha Jesslyn with my last sheet number is 248, and now I will present to you the contraindication of IVP. So there are certain contraindications regarding IVP that warrant careful consideration to prevent potential complication. First one is contrast media allergy, particularly iodine-based contrast agent. Therefore, pre-screening for contrast allergy is crucial. And then impair renal function. Patients with pre-existing renal insufficiency or renal failure are susceptible to contrast-induced nephropathy. And then further deterioration of renal function. And then pregnancy. Ionizing radiation exposure during IVP may pose potential risk to the developing fetus, including teratogenic effect and radiation-induced malignancies. Therefore, alternative imaging such as ultrasonography and MRI are recommended. And then patients with hypothyroidism are contraindicated for IVP due to the risk of exacerbating thyroid dysfunction. Thank you.
Thank you for the opportunity. My name is Ningrum, and I will explain about the complications. IVP is thought to be interfered with kidney function due to contrast dye, so the dangerous complication may occur in patients with significantly impaired kidney function, diabetes or multiple myeloma, and patients who are dehydrated. In addition, radiation exposure can be dangerous for women who are pregnant. For some people, allergic reactions such as nausea, vomiting, sneezing, itching, and even anaphylactic shock may be caused by contrast staining. Further studies were also conducted regarding IVP complication in patients with hypertension, heart disease, and elderly patients. Therefore, based on the complication and allergic symptoms that may arise, the use of IVP needs to be limited to certain cases, and careful attention to the patient condition is required before carrying out an IVP examination.
Hello everyone, my name is Dewa Agung Guptha with the last three digits of student's number 3472. So at the given moment, I'd like to give the preferences and educations to the patients. So we can divide the education itself into two kinds of the timeline. The first one is that the before procedure, and the second one is that during the procedure. So before procedure, we can instruct the patients to do fasting, bladder emptying, laxative, and we can give the explanations about the procedure itself. And then we can read checking about the medical history, and also we advise the patients to remove the metal object, and then screening for the pregnancy and outpatient basis. But during the procedure, we can also give the instructions for the patients to not doing any of the unnecessary movement, and then we can tell the durations of the procedure itself to the patients, that is 1 hour, and then we can use the compression bands during procedure. That's all from me. Thank you for your time.
Allow me to introduce myself. My name is Carla Noveline Manullang with my last three digits are 146. And now I'm going to give the conclusion and advice from SGDB3 student group project. So the conclusion is intravenous pyelography or IVP is a medical procedure that involves injecting contrast agent intravenously and then using X-rays to examine the urinary system. IVP is used to assess a range of problems, including kidney stones, urine infections, blood in the urine, and obstruction or damage to any part of the urinary tract. IVP is still indicated, particularly in situations of hematuria, pelvic or low back discomfort, and possible anomalies of the urinary tract. IVP is thought to interfere with kidney function due to contrast dye, so that dangerous complications may occur in patients with significantly impaired kidney function, diabetes or multiple myeloma, and patients who are dehydrated. Next, the advice from our group SGDB3 for the student project is, for patients who will undergo intravenous pyelography, it is essential to ensure the patient's safety and effectiveness before, during, and after procedure. Before procedure include fasting, bladder emptying, laxatives, explanation of procedure, medical history, removal of jewelry and metal object, pregnancy screening, outpatient basis, and also pre-screening for contrast allergies to prevent adverse events. Procedure that can be invoked to the patient during procedure such as the procedure duration, compression bands, and instructing patients to be remain still. It is also important for the patient to drink plenty of fluids for the rest of the day to help flush out any remaining contrast material. So that's the student project from our SGDB3. Thank you all for your attention and participation. We hope that the information that we share will be valuable, and we were looking for your critique and feedback. That's all from us. Thank you.